Rehabilitation is very important in spinal cord injury. This condition is known as central cord syndrome. So the presentation would typically affect the upper limb more so than the lower limb, and they would usually have pain, spasm. They may even have bladder and bowel incontinence.
Bladder dysfunction is common among patients with spinal cord injury, and this condition is called neurogenic bladder. Neurogenic bladder causes the patients to lose the sensation to urinate, and the bladder can fill beyond typical capacity and leak or incomplete emptying. Our rehab nurses are trained to assess residual urine through the use of a bladder scanner to detect incomplete emptying of bladder, and patient will be taught to drain urine out of the bladder by inserting a hollow tube or catheter into the bladder every 4 to 6 hours.
A good rehab care center need to have trained and experienced professional. A multidisciplinary team will consist of a rehabilitation physician, a physiotherapist, occupational therapist, a rehabilitation nurse, as well as a speech therapy. Multidisciplinary team is much needed to ensure that the different domains of impairment is met. And on the physical aspect, the physiotherapists need to look into ensuring that their mobility skill is looked into and fall precaution is given to them.
We make sure we bought the machine which is specialized in certain needs for the patient. For example, we have to do a lot of practice of sit to stand. In order to do sit to stand, patient need to use certain machines which will really enhance.
In central cord syndrome, the hand therapy is very important, whereby they need to start working on their fine motor skill to ensure that they will be independent in their activities of daily living. Rehabilitation, yes, it does give patients a lot of hope.